Hello, everyone. Welcome to today's webinar, Catalytic Capital. How do investments in social enterprises advance global health goals? I'm Elizabeth Corley, Director of Communications for the Sustaining Health Outcomes through the Private Sector Plus project with ACT Associates. SHOPS Plus is USAID's flagship initiative in private sector health. And today, we'd like to share some insights on the role of donor-funded programming and private capital in financing and scaling innovative solutions in global health. It is my pleasure to introduce our first speaker. Elaine Minotti is Deputy Chief for the Service Delivery Improvement Division within USAID's Office of Population and Reproductive Health, where she has worked since 2011 supporting service delivery programming and private sector engagement initiatives. She is also the SHOPS Plus Project's Agreement Officer Representative. Elaine?
Thank you, Elizabeth. Good morning and good evening, everyone. My name is Elaine Minotti, and thank you for joining this SHOPS Plus webinar, where we will go back nearly a decade ago to the launch of a challenge fund designed to support and advance private healthcare businesses in sub-Saharan Africa and review a SHOPS Plus study that followed some of these challenge fund recipients over time. And later, we will go into a panel discussion to discuss the implications of the study's findings. The HANSHEP Health Enterprise Fund was designed in 2012 and launched in 2013 in partnership with the UK Department for International Development, or FCDO now, and the Rockefeller Foundation. This fund was implemented as part of a former multi-donor and stakeholder group, HANSHEP, Harnessing Non-State Actors for Better Health for the Poor, which aimed to support and amplify private sector solutions for private in healthcare. Next slide, please. The HANSHEP Health Enterprise Fund was a health innovation challenge fund designed by the Strengthening Health Outcomes through the Private Sector Project, or SHOPS, the predecessor to SHOPS Plus. It sought to identify and support innovative and replicable private sector solutions that address voluntary family planning and other critical health priorities. We looked for small or medium-sized healthcare businesses that had a sustainable revenue-generating business model, addressed key health issues, that were working in Ethiopia, Kenya, or Nigeria, that were providing goods and services that resulted in improved health outcomes among low-income communities. The HHEF was designed to fill two gaps commonly faced by early-stage health businesses: financing at critical points in the business growth and technical assistance to move tested ideas and solid concepts to greater scale for impact. Next slide, please. So from 2013 to 2015, the HHEF provided support to selected health enterprises to strengthen their businesses and attract additional financing for scale. These selected healthcare businesses were provided with 1 to 2 rounds of financing, tailored technical assistance, and participation in a cohort model that encouraged business-to-business sharing, and also connections with investors and relevant partners through a local business advisor in each country and through global networks. Next slide, please. The HHEF supported healthcare innovations by a range of healthcare businesses at different stages, some more in the idea stage, and others looking to strengthen, refine, and expand their models. Examples of these included replicating a mini clinic model to create a chain of mini clinics in urban Kenya, creating a network of health kiosks across Kenya, expanding a telemedicine platform offering phone-based medical consultations in Ethiopia, expanding the availability of affordable sanitary pads for women and girls in multiple countries, and expanding and strengthening laboratory services. Next slide, please. So I wanted to share a few high-level results from the HHEF during that period of support. SHOPS supported 16 early-stage health enterprises, which in turn delivered 75,000 health services during that period. 6 of the recipients attracted additional investment before the end of the program from a mix of private investors and donors. So to wrap us up, why was USAID interested in supporting this challenge fund, and then also afterward providing additional tailored support after the end of the fund? There was this recognition that small and medium healthcare businesses and social enterprises were playing a valuable role, understanding their local health markets and responding to needs and opportunities in their context. So we wanted to see if there was a way to support these entities with a package of financial resources, technical support, and networking to further support their business goals while also achieving key health outcomes. Next slide, please. So with that, I'll pass it back to Elizabeth, who will introduce our next presenter. Thank you.
Thank you very much, Elaine, for that overview of the HANSHEP Health Enterprise Fund. Next, we'll hear from our moderator, April Warren. April is a senior private sector advisor with Apt Associates who has over 12 years experience empowering social entrepreneurs to tackle global development challenges. April previously managed the HANSHEP Health Enterprise Fund, and she also served as an innovation advisor at USAID's Global Development Lab. April holds an MS from the Harvard School of Public Health and a BA from the University of Michigan. April?
Thanks, Elizabeth. So today I'm here to present to you on some of our key findings from the longitudinal study of the HANSHEP Health Enterprise Fund. And that study was led by our SHOPS Plus partner, the William Davidson Institute at the University of Michigan. Next slide. So as Elaine described, the Health Enterprise Fund provided support from 2013 to 2015. But when we're investing in innovative solutions, it doesn't always yield immediate impact. These business models can change, scale can take time. And so through this study, we really wanted to understand how the Health Enterprise Fund facilitated grantees' efforts to increase and also sustain access to family planning products and services, even beyond that initial period of project support. Because we were looking to understand the effects of the fund on family planning, we purposefully selected 3 grantees for the study using the following criteria. First, a demonstrated increase in access to family planning since the beginning of the Health Enterprise Fund support. Second, an ability to provide high quality data on the number of people served with all health services and family planning services and products. And then, of course, a willingness to participate in our study by sharing those statistics and participating in qualitative interviews over a multi-year period. The grantees that we selected through this criteria were Jacaranda Health, Afia Research Africa, and Telemed Medical Services, whose primary product is called Hello Doctor. So our study collected annual service delivery statistics and then also explored different qualitative topics through interviews over 4 years. Some of the qualitative topics included how enterprises integrate family planning into their business model and sort of the contributions of family planning to that business strategy, any lasting effects of the Health Enterprise Fund on the enterprises, and also how each enterprise pursued quality assurance, what approaches they used, and what motivated them to pursue these approaches. So our first set of findings that I'm going to go through today is around the enterprise's business journeys. And when we talk about innovation and trying to find new ways to deliver services to the poor and to do that sustainably, our journey is really important because it's not a straight path, and social enterprises are trying to constantly balance the social impacts that they set out to achieve, as well as their own financial goals. So I'm going to give some very brief highlights of these journeys, but I would encourage you to see the richer details in our report. So starting with Afia Research Africa, or ARA, they run a network of primary care clinics across rural, underserved areas of Kenya. These clinics are co-owned and operated with local community groups and supported by revenue-generating ventures that help to keep the prices to end users low. An example of a non-health venture would be M-Pesa mobile banking services offered to the community. ARA opened their first kiosk in 2011 and then was awarded seed capital from the Health Enterprise Fund in 2013. With this support, they grew to a network of 10 comprehensive clinics, which by 2015 were each able to recover 99% of their operating costs within 1 year of operating. And then following the fund from 2016 to 2019, ARA secured a number of follow-on grants. And this financing aligns with their decision to continue operating as a nonprofit and help them to both expand their reach as well as their service offerings to offer more comprehensive RMNCH care, as well as HIV treatment services and NCD care. Since 2020, they've operated a network of 25 medical centers across Kenya. So since receiving the Health Enterprise Fund support, ARA has steadily grown the total health services that they've delivered. Family planning services have also grown substantially, increasing fivefold since 2015. And on average, family planning represents about 8% of total services delivered, with family planning being one type of services they integrate into their broader primary care model. So moving to Jacaranda. Jacaranda is a hybrid for-profit social enterprise and nonprofit focused on improving the quality of maternity care across Kenya, both through their direct service delivery in peri-urban Nairobi, as well as through partnership initiatives to expand their impact. They received support from the Health Enterprise Fund in 2013 to test a key hypothesis based on their experience with their first center. They wanted to understand, would having emergency obstetric care capacity lead to more deliveries happening at their facilities and thus attract more revenue? They also received a follow-on grant from the Health Enterprise Fund to pilot a quality improvement initiative that would work in public facilities. So in 2015, they opened their new Kahawa West facility, which had an operating theater and an ambulance to support emergency obstetric care. Then in 2017, they made the decision to spin off Jacaranda Maternity, their maternity center business, as a for-profit social enterprise. And soon after, their maternity hospital was able to break even and then was recognized as the second most affordable, high-quality maternity hospital in Kenya. In 2020, Jacaranda secured investment to open 2 additional facilities with a mix of private and philanthropic investors, including the Asia Africa Investment and Consulting Group, who you'll hear from later today. So since participating in the Health Enterprise Fund and opening their maternity hospital in 2015, Jacaranda has achieved substantial growth in the women that they've been able to serve. And their delivery of family planning services grew and then remained relatively steady since 2017, delivering between 800 to 900 family planning services per year. These are primarily postpartum family planning services. Moving to Ethiopia, Telemed was founded in 2012 to establish Ethiopia's first mobile-enabled telemedicine platform. They had the aim of providing a majority rural Ethiopian population with access to healthcare providers 24/7. Telemed received capital from the Health Enterprise Fund to continue building out the capabilities of their Hello Doctor platform and to try to grow the platform's number of users. They also received support from the fund to develop an HIV and TB patient tracking system that would allow providers to register and then provide automated follow-up with patients. So soon after joining the fund in 2014, they also secured a private investment from a US-based venture capital firm. And together with the Health Enterprise Fund support, this revenue enabled them to invest in marketing and grow services by nearly 300% by 2015. In turn, this added scale allowed them to reduce their prices to end users by 25%, which had been an important social goal. However, in 2018, Telemed realized that they really needed to adapt their business model and shifted from a business to consumer to a business to business model, in which they began to bundle telecounseling services together with insurance products as well as diagnostic tests. So Telemed was able to nearly triple its services between 2014 and 2015, and then significantly grew services through 2017, as you can see in the graph. Call volume then declined in 2018 when Telemed made the decision to pivot their business model and suspended marketing of Hello Doctor to the public. In terms of family planning, Telemed provides callers with FP counseling, information on reproductive health issues, and information on where they can access contraceptives near them. Telemed actually started disaggregating its data to further track calls about family planning and reproductive health while participating in the Health Enterprise Fund, and then saw steady growth in these calls both during the Health Enterprise Fund support as well as a dramatic increase directly following support. So now I'm going to get into some of our findings from the final year of our study, where we looked across the grantees and the different topics that we explored. Our study included rich findings across a range of different qualitative topics, as well as further findings on the business case for social enterprise investment beyond what I have time to get into today. And so I'd encourage you to check out the full report. So health enterprises are not only looking to grow their services and their revenue, they also invest in quality. The enterprises that we followed implemented quality standards beyond any that were required by their governments, and they used a variety of different tools, organizational systems, and structures to improve quality in their facilities. They're motivated to make these investments because high quality service provision is fundamental to their value proposition. High quality contributes to their brand and reduces the cost of customer acquisition as they rely heavily on word of mouth marketing. Jacaranda has even won some awards for their quality of care, 2018 Geneva Forum Award, for their contributions to high quality, sustainable, and patient-centered healthcare at scale. The social enterprises we studied are also strengthening the country's broader health systems. So Jacaranda is partnering with 5 different counties to mentor nurses and integrate cost-effective innovations into public sector hospitals. And ARA has partnered with 4 different county governments to strengthen FP and RMNCH services in public primary facilities. Further, both of these enterprises have developed digital innovations that are serving the broader health system. So the Stone HMIS platform ARA developed to manage care in their own clinics has since been rolled out to public facilities and is improving continuity of care and data management. Jacaranda's Prompt service uses artificial intelligence to provide a free mobile chat service to over 250,000 women across different facilities and was adapted to deliver critical COVID-19 information in response to the pandemic. Social enterprises in the health sector can also contribute to other development goals. As an example, investing in social enterprises creates jobs and can contribute to women's economic empowerment. Using ARA as an example, their medical centers have created new full-time jobs for 50 healthcare workers, 34 organizational staff, and part-time jobs for over 100 community health workers. Indirectly, their transport services required for clients and staff to get to clinics also fuels economic activity and some job creation. So I want to end with this quote, which I think we've seen in the journeys of the Health Enterprise Fund supported social enterprises as well as their leaders. These entrepreneurs are not just trying to create a business and grow it, but they're looking to revolutionize the way healthcare is delivered and find ways to increase family planning access for the underserved. And to do this sustainably, they'll explore a variety of different business and partnership models. So with that, I want to get into our panel discussion so we can have some broader perspective on the implications of our findings, as well as on how programs like the Health Enterprise Fund fit into our ecosystem for healthcare innovation. So to introduce our panel, starting from the left, we have Colin Fay, who is the Senior Director of Market Strengthening at the Clean Cooking Alliance. Colin previously managed the HANSHEP Health Enterprise Fund and led our longitudinal study until 2019 with the William Davidson Institute. He has expertise in enterprise scaling and partnership ecosystem development and brings experience across international development and business, including projects in sub-Saharan Africa and Asia. Dr. Sam Gore is the Executive Director and co-founder of AFIA Research Africa, one of the social enterprises that we spoke of today. He's also a senior lecturer at Kenyatta University School of Medicine, where he advances research and training programs on child neurology and child neurophysiology in the region. He's first trained as a pediatrician and has a PhD in child neurology from the University of Amsterdam. Njagi is the co-founder and CEO of Grow Africa, a healthcare incubator in East Africa that has supported nearly 50 businesses and dispersed over 1.2 million in seed funding. These startups have gone on to unlock $18 million in follow-on funding and touched over 2 million lives. Well plugged into the entrepreneurial system in Kenya, Wilfred previously worked at the African Venture Capital Association and at They'll India. And finally, Shigeru Honda is a director at Asia Africa Investment and Consulting. and he manages the firm's Africa Healthcare Fund, through which their company has invested in over 30 companies in Africa. He leads investment in innovative startups and advises businesses on expansion strategy in Africa and the Middle East. He brings over 20 years of experience across early stage investing, business strategy consulting, and international development. So with that, I want to kick off our panel with a question to Colm Fay. Colm, you had the honor of managing the fund in its early days and helped to design and lead this study. So ask you is, do you feel like the Health Enterprise Fund did what it was intended to do? And how do you think the fund's grantees really revolutionized delivery of healthcare to the poor?
Thanks, April. I'm really glad to be with you today. I think firstly, when you look at the graphs in the slides that you presented, it's clear that the fund did achieve its objective of seeding and helping to scale some new solutions and new business models and business model innovations that really increase access to family planning products and services. But I think another way in which I think about success of the fund is in taking a high degree of market risk to test out ideas. Not all of the projects were successful. We talked about telemed there. You have to expect that because innovations really by their nature are not guaranteed to be successful. Otherwise, someone else would have done it. And taking this kind of market risk, that's exactly what we should be using concessional capital for. But I think the study also highlights that in some cases, you can have a good idea that is well executed by a capable team, but that's not always enough. And these enterprises also depend on a market ecosystem existing around them to ensure that the business has that pathway to scale ultimately.
Follow up. You talked a little bit about market ecosystems and sort of whether they're ready. And I remember that in the study, we were wondering, what would have happened if they launched their services right before COVID-19 when telemedicine really took off? Would Ethiopia have been ready? But just for our audience, what do you mean by market ecosystems?
Well, really, it's the system of policies, of institutions. Maybe public-private partnerships are a good example of that. But of course, also the public and private capital flows that are necessary to allow an enterprise to scale. And when you look at examples like Afia Research Africa, like Jacaranda, I think the fund came along at a good time to catalyze the business, to provide those additional resources to take advantage of that market ecosystem that was sort of already mostly there. As you said, as you highlighted, they also contribute to building some of that market ecosystem in both of those cases, making contributions to that infrastructure. And then you have other cases like with telemed, where the ecosystem wasn't as robust. It made it more difficult to build a sustainable, scalable business. And so you're tasked with not only testing out a new business model, but you're also having to build some of that market infrastructure as you go. So really just, makes a difficult task even more challenging if that platform isn't there to support scale.
Thanks, Colm. So Sam, you actually participated in the Health Enterprise Fund as the leader of Afia Research Africa. You can tell us a little bit about the impact of the capital as well as the technical assistance you received from the fund company and how it influenced your company's trajectory and growth.
We received funding at a time when we were still experimenting with our model, and that meant that we weren't quite there yet for a potential investor to provide the capital that we needed. And what the Health Enterprise Fund did was to provide patient capital that had some flexibility in allowing us to experiment with the certain pathways in our model. And in addition, we also did receive quite a bit of technical support, one of which was a big deal for us, was reviewing and refining our government structures. That meant that by the time then our model was scaling, we had quite a lot in place, and we were attractive to other potential partners and funders.
Great, thank you, Sam. So Shigeru, I'm wondering if you can give us a little bit of the investor perspective on this. Do you feel like the type of support provided by the fund and donor funding in general really supports a stronger pipeline for private investors like AAIC? Yeah.
I couldn't hear the question. Can you repeat the question?
Yes,
Sorry.
sorry. And we're lucky to have almost all of our panelists calling in today from Nairobi. Yes, so Shigeru, just wondering how you feel like initial funding and technical support from programs like the Health Enterprise Fund or other donor programs helps to build a pipeline for investors like AAIC.
Okay, thank you very much. I'm glad to be a part of this panel, and I'm joining from the Nairobi. And actually, we based in the Jakarta maternity and visited Jakarta and the hospital this morning. So glad to see they became a bit positive with one hospital, and I was also visiting the new location, or third one for 2020. So with the, let's say, based on the donors' support, we invest, as an investor, we invest in the, let's say, the future of the scalable business model and its team. So future growth and scalability are critical factors. And of course, we have to have a good exit. And the in response to your question, it's really outline. The programs really help the startups to fine-tune their business model and test the hypothesis how they can enhance their program. So the initial support from the donors will be, helping the startups, which at the end, resulting in the stronger pipeline in the ecosystem, so that we will be able to come in and see whether these startups become the scalable or commercially viable for our future investments. Thank you.
Great, thank you. And so Wilfred, Vilgro's worked on a wide range of donor programs as well, but they're intended to strengthen social enterprises and help them to invest more private capital, like the capital that AAIC provides. So do you think that donor programs like the Health Enterprise Fund can help build a pipeline for private investors? And what do you see as sort of the different roles for donor programs versus private investors in helping to identify and scale different innovations in global health?
I'll begin by just almost quoting what Sam just said, that he received the funding at the time that they were experimenting with the model. Right? There is need for grant capital for this kind of experimentation, which private investors like AIC and ourselves, we don't have that kind of risk appetite to come to you when you're still experimenting, right? We need you to have met some proof points. And that's where a grant comes in, whether it's basic product design, or is it validating the hypothesis, doing a bit of trials, getting MVP ready. There's room for grant capital. And as Shigeru was saying, this builds the pipeline for downstream investors. We need grant givers to even give to more enterprises, right? Out of 100 that are funded by donors, maybe only 20 will reach commercial viability for people like us to come in and incubate. And even after incubate 20, maybe only 5 are lucky enough to unlock follow-on funding, substantial follow-on funding from investors like AIC. So it's like a baton which has to be passed from the left by the grant givers. Then it comes to us in the middle who are more flexible. I mean, we don't look at just returns, but we also donor funded. So we are able to take bigger risks than a typical VC fund. And as we take those risks, we are now bringing in the business element, the business development element, making them investment ready, so that now we can pass on the baton again to downstream investors like AIC. So I agree that there's a place for donor funding, 100%.
Thanks, Wilfred. I think everyone liked your metaphor with the baton. I saw a few smiles on the panel. So Sam, we've heard a little bit from the investor side on the role for donor funding, especially in helping to sort of validate and strengthen business models, and you talked about that. But of course, donors like USAID are interested in investing in the first place because of the specific health or development impact that they want to see. And so in the case of our Health Enterprise Fund, that was around family planning access and increasing that access for underserved populations. Can you talk a little bit about how central family planning and reproductive health is in Ophea Research Africa's business, and whether sort of the donor priorities that were in this fund kind of played a role in the way that you view family planning and reproductive health services in your model? Could you hear me, Sam?
Can you just say that again, please?
Yes. So just wondering about the role of family planning and reproductive health in ARA's business model, just because we know that donors like USAID get involved in businesses like yours because they're interested in that, some specific health and development impacts.
By the very design of our model, we essentially defined an integrated service that covered all the needs of the community. We believe in providing family planning and other related reproductive, maternal, and newborn child health services. But the way these services are presented, and the fact that quite a bit of it is also available from public health sector, they do not necessarily provide significant revenue to promote self-sustainability of the services by themselves. So what we were able to package and believe in is in the fact that we could integrate the various needs of the communities with some not so profitable but necessary needs like family planning. And in so doing, then be able to deliver on some of the needs from funders.
Great, thank you, Sam. So one last question for you, Colum. I'm hoping you can bring us back to the study before we open up to audience questions. You know, looking above the impact of the Health Enterprise Fund on individual businesses like ARA, what do we think we can say about programs like the fund? You know, what do they do in terms of helping to advance USAID's global health and family planning goals, sort of at a high level?
Well, you know, I think there are direct learnings that, in the first instance, direct learnings that all of these companies have had about how to best to deliver family planning programs. So, for example, some of the things that Sam is doing, Sam and his team are doing around accommodating non-communicable diseases when it comes to family planning. There are technical innovations there in terms of the protocols and how you know, they've been developed. Jacaranda's work that you mentioned around quality improvement, and other insights about what influences uptake. You know, all of these technical innovations can be implemented across future family planning interventions to make them more impactful. But they also have to understand you know, what it's going to take to deliver all of these services sustainably. You know, Sam was talking about integrating family planning, maybe not as a huge revenue generator, but you know, as a service that brings patients to your facility. You know, in terms of the individual business models and the capabilities that the businesses need to deliver family planning products and services, you know, I think there's a lot of learning there about how to develop interventions that really, you know, take that integrated view of service delivery, and you know, I think there's learning there as well in terms of what it's going to take to accelerate the market for these types of services. So I think both in terms of the individual business model innovations and technical innovations, but also what is the full system that we need to build here to ensure that delivery of these services is sustainable.
Great, thanks, Colm. So just before we open up, I want to give everyone on the panel a chance to share any closing thoughts. And so I want to ask, how do we do better in the future on this kind of programming? If you could leave the audience with sort of one thing you wish future donor programs could do to help to attract more private capital to support the financing and scale up of global health innovations. Colm, do you want to go ahead and go first?
Yeah, sure. I mean, I would say that donor programs should really focus on building long-term facilities, even institutions, to support ventures, to develop innovative technologies and business models, and build those capabilities that teams need to bring those to the market in a way that can be profitable and a way that can be scalable. And then in parallel, investing in those market systems that makes it possible for scale to happen. I think in my mind, that's what private capital is going to need to come off the sidelines to a greater extent. And then, as we've discussed, the fund was catalytic for several of the enterprises in the portfolio. But going back to the study, I think one of the big learnings and insights there is just how long it takes to build ventures. It is a long-term endeavor, and companies need that long-term support to be successful.
Great. So really thinking about sort of those longer-term support options and the longer-term journey of these businesses. Shigeru, what about you? What's the one thing you would ask donor programs to do in this space? I know your bandwidth might be struggling a little. Shigeru, can you hear me?
Can you hear me?
Yes.
Yes, I can hear it. Can you hear me? Oh, okay, good. Yeah. From our perspective, I provide the CMI that with clarity on scope and the expectation for the support to be provided, either through grant or business development support. For example, as a grant, I do agree with the call that long-term continuous supports are very important. But at the same time, if we want to make the startups commercially viable, continuous donor funding sometimes may result in heavily relying on the grants and may not necessarily accelerate their growth for scaling up. So defining its scope or from the donors' support is quite important, whether they will be specifically supported at one stage or continuous. And as the business development support, it could be as an example through an acceleration program or in partnership with Accelerate Innovator work with, and to start seed early global health businesses so that they could help start engaged with innovative ecosystem, including investors like us in the earlier stage. Thank you.
Thanks, Shigeru. I think you were cutting out a little bit, but I think we heard you around the sort of seed capital and space to experiment on business models. And then the importance of really being clear about donor expectations and what is sort of the purpose of the donor support and the scope of that before you make your move and define your programming. Wilfred, what would you leave us with?
Just looking at this panel, we have the full stack capital represented here. So we have donors here, we have incubator, accelerator, we have downstream investors. My wish would be if we could do this at the beginning of the program, right? Where we all start the same team, the same actors represented here from different entities. Have this kind of people at the beginning of the program, where we have investors like AIC saying, these are the outcomes that I would be looking for. These are the proof points, KPIs I'll be looking as I track these grantees. These are the things I'll be watching out for me to make an investment. Then we have incubators, accelerators saying that this is the kind of technical assistance I would provide to your cohort of grantees to be able to meet AIC's mandate, right? So we come in much earlier and we try really move them further along. And then we ask the donors how much, in addition to grant capital, is there funding available for TA, which is always like smallest percentage. I think 5 to 10% of the, if 5% of the funding went towards TA, then you have a much higher success rate at the end. So instead of having a post-mortem at the end and asking what happened or how could we have done it, can we then move that into a working group model where the same people, the same panelists are involved from day one, all the way up from selection, so that they ensure that we're selecting the right companies, and then we are moving them further along. Then I think that will increase our chances of success.
Thanks, Wilfred. I like that. And I know that in our selection process at the very beginning, we had investors involved during our final pitch sessions, and they gave some good feedback, but we didn't necessarily, continue to work with those same investors throughout the entire program. So a great suggestion. And Sam, as sort of our most experienced participant in this program, anything that you would ask for future donor programs in this space to help businesses like Afia Research Africa?
Well, I like what Colma said, and the long-term outlook is really good, because anyway, enterprises that persist through are the ones that are most likely to succeed. And to define shorter outputs and outcomes really goes against that expectation. But that said, also, I think there's an opportunity to leverage local capital, essentially to get more and more local entities to also invest. There is an opportunity there for hand-holding. One, because of the greater awareness of local participants in the local space, and the opportunity to also learn from Western-based funders on how to navigate that space. I think there's a lot of opportunity in that. But capital also is to, and that may, in a way, help with what I think is a bias in funding towards non-local actors. I guess it's not intentional, but perhaps it's on account of familiarity and language issues, which are a great barrier in participating in such initiatives.
Great.
Yep.
Thank you, Sam, and thank you, everyone. So we have some questions from the audience. I'm going to start with this clarification question just on the fund that I'll answer and then open up. So we were asked how many enterprises were not studied, and were they not studied because they didn't demonstrate an increase in family planning services? So that's a great question. Overall, the fund funded 16 enterprises, and we only did the follow-on study with 3 enterprises, in part just because of the scope and resources for our study. But in terms of, we selected businesses that were working in family planning because the fund had actually a broader array of funding sources beyond just the Office of Population and Reproductive Health. And so we were also looking at innovations in the maternal and child health space and in the HIV space. And so some of the grantees that we supported had no family planning services that were part of their model at all. So we did not select those enterprises to follow, but we did try to look at those that where family planning was a part of their model. So I hope that answers that question. I'm happy to add more. And then we have a question for Wilfred to start. So what makes an enterprise one of the lucky ones for future onward funding? And what makes them different from those that don't get funding?
I think they say, as the saying goes, luck goes to those who are prepared. Maybe I needed to qualify that statement further. So these lucky ones, what I meant is the ones that actually work to get a product market fit. They start getting the initial revenues. You have a clear pathway to break even and profitability. So there are all these things that we as investors look for as signals that show that this is a bankable idea, right? So it's not just sheer luck, but there's a lot of hard work behind that luck. Yeah.
Great, thanks, Wilfred. And for Shigeru, we have a question. So the audience is wondering how.
If I may add,
Oh, go ahead. Go ahead.
I think business model is one of the key. When at the same time, the founders team, they are the ones who grab the lap. And so think of how resilient they are. How that's the team is also one of the very important success factor. I just want to touch that team is quite important. Thank you.
Yeah, thank you. And then we actually have a question for you, Shigeru, around Jacaranda's decision to pursue a hybrid model and to split into a for-profit social enterprise on the maternity side and then keeping their nonprofit. Did this make any difference in your decision to invest or play any role?
Yes, definitely. And if they have the, for example, hybrid model, having the under the one umbrella, having the social NGO type business, and also the commercially viable business, then we would not be able to invest from the investor's point of view. We have to have the clear distinction between the business or the scaling up and investable one. And the social impact side, it's very important to continue, but it's not our investors' mandate to come in and support. That's more of the how the donor can continuously support business. And so I think it's important to make it clear which will be needed for the donors' continuous support and what business can become their commercial viable. And without this clear distinction, we cannot even look at. So Jacaranda made it clear that this maternity hospital side will be profitable, and so that we came in and we made the decision.
Great, thank you. Yeah, I know that when we were working with Jacaranda, it was always a bit of a balancing act to sort of figure out the many things they wanted to do that they thought would have a bigger impact in Kenya and even in East Africa. And I think now they even have some initiatives in the United States.
Sure.
But that they understood that didn't all help the sort of financial picture of their maternity centers and doesn't really help improve out their business model. It was just things that they wanted to invest in to make that social impact. So thank you for clarifying. A question for Colum, and I can jump in, Colum, if you want as well. Regarding the cohort versus tailored acceleration support, did you look for any difference between those approaches and impact across the enterprises? So Colum, maybe you can speak to the study and if we looked at that at all, and I'm happy to add.
Yeah, so we didn't really. I think what's maybe the main reason is because all businesses are different businesses, right? And in some cases, a cohort model that provides capacity building around financial management for one company might have a diffuse set of impacts across the company. For another business, that might be a particularly weak point, and some cohort or being involved in a cohort around financial management could have a transformational effect on the business. By the same token, tailored support would in one company might be the key that unlocks a new product category, a new customer segment, or something like that. Again, could be transformational. And in another company, could be maybe what allows you to incrementally grow your business. Still important, but maybe a little bit more evolutionary rather than revolutionary. So I think what makes it challenging to understand the relative impact of cohort versus tailored or other aspects of technical assistance is that the context of all of these companies is so different, and their pathways are so different. It's really hard to have a level set to compare against. So I think it was challenging, but the insight that I think comes from that is really you have to when you think about developing these kinds of programs, there are certain building blocks that you can put in place that most companies are going to need, but in some cases the right solution is going to be tailored and more focused support.
Thanks, Colum. And I would just add, we did look into that question some, right following the end of the fund, not as part of this study, and have continued to do some programming with similar businesses since then. And it seems like, many of the social entrepreneurs I've spoken with really prefer that tailored support, which I think makes sense because it's, it's designed directly to respond to their needs. But then I think the challenging part is that becomes kind of expensive and difficult to scale. And so how do we sort of balance getting everyone the support that they need and still making it effective and a good use of entrepreneurs' time? So that's what I would just add. We have a question for Sam that I like. That's what's next for AFIA Research Africa, and how are you going to continue to revolutionize healthcare in Kenya?
Wow, there are lots of things we're thinking about, but we're always innovating and trying to figure out how best we can continue being sustainable and deliver care in more spaces. We resonate with the needs. So most recently, of course, we've been instrumental in supporting COVID care and community awareness during the pandemic. And of course, that has had its effect on public health systems. And so the other thing we've fitted in is very well providing stable and consistent support for communities that are ordinarily underserved. And then come COVID and everything is withdrawn. So we're very happy about that, that has been a consistent pursuit. But we are also very, very interested in the interaction between non-communicable diseases and communicable diseases and maternal and childcare needs and family planning on the understanding and on lessons that indicate how there is a significant interaction between these needs, and that has been particularly stuck even during the COVID-19 pandemic. So that's us. We have defined a hybrid model, and we've got both a non-profit way of pursuit and for-profit side of things.
Great, thank you, Sam. I'm just checking if we have any other questions. I think I just want to give everyone a chance to offer any final thoughts. I know we touched on some different topics from the audience Q&A. Any final thoughts from the panel?
I'll just offer up one. I think, in our discussions before the panel, April, we talked about, what was the most valuable piece of support or element of the model for the Health Enterprise Fund. And something that came up in the conversation just reminded me of this. I think, one of the pieces that was actually the most valuable thing that we did was the technical assistance that we provided to companies before they applied to the fund. That helped many companies to formulate their ideas for the application process. And on the one hand, it improved the quality of the applications, but it also helped to build some important capability within those organizations who applied, regardless of whether they were selected or not. And going back to that idea of maybe in some cases, these programs being more accessible to non-local companies, I think the more that we can do to build in this kind of support to create easier ways for local companies that maybe are not as familiar with the processes and the applications and the proposals and all of that world. I think the more that we can do to create an access point, an entry point for those kinds of companies through these types of pre-application support and helping to build those capacities, I think can go a long way to just opening up, making these programs more inclusive and more accessible to locally owned companies.
Thanks, Colum. Anything else from anyone else? Otherwise, we can close.
Just I want to add, and I think Walfred also mentioned this time of connecting the dots, we are very beneficial to the extent. For working space, accelerators, angel investors, VCs, there are lots of different players and donors as well. And sometimes it's quite fragmented, unfortunately. So it's important to know each other and jointly, collaboratively support the startup. So this kind of support from to make a strong community is very attractive and very important, and from the investors' perspective as well. Thank you.
Great, thank you, Shigeru. I think we certainly agree. I know on reviewing our experience with Health Enterprise Fund prior to this study, that was something we heard from a lot of different stakeholders across the ecosystem, was the need to really think about all of the players across that ecosystem and how you bring them in and make sure your programming is really something that's going to connect those dots. So with that, I want to thank our panelists for tuning in from Jacaranda Health, from a couple different places in Nairobi, and from, I think, upstate New York. And turn it over back to you, Elizabeth.
Thank you, April, and thank you all for stimulating conversation. We heard a variety of perspectives on donor-funded programming and private investment to finance and scale innovative solutions for global health using a social enterprise model. And we'll send out the recording later this week. Thank you all for joining us. This concludes the webinar.